Alexis, and this is my mom who's going to be volunteering to be my patient so I can show you the two-step authentication for taking blood pressure manually. So essentially, a two-step process is taking the first reading and then also taking a second and averaging the two to get a more accurate result. So the first thing you want to do with your patient is make him or her sit down in a tall position. So as you can see, you would want the arm to be exposed. You're going to want your patient to have a wrist side up, and you're going to want to find the brachial artery, which is along the inner side of the elbow. You essentially want to take 2 fingers in finding it, because the thumb has its own pulse and you'll get confused. If I try to find it here, you'll think it's there when it's really not. So once the arm is exposed and you find the brachial artery, you want to put the cuff on the patient. And if you're having trouble finding the brachial artery or trying to put the cuff on in the correct manner, on the cuff there are arrows to point where the brachial artery should be. You want to have the cuff at a snuggly place. If you have it too loose, you're not going to get a reading. If you have it too tight, you're going to get an inaccurate result. So a finger of thumb is, you want 2 fingers to fit in here at a comfortable place. So it fits, and you want 2 inches above the brachial artery. So 2 fingers. And once you have this on, you want to get the sphygmatometer hooked onto the side so you can get an easier result to see. And you want this to be essentially at an eye level. You want to put on your stethoscope so you can hear the first beat, which is going to be your systolic. And for your diastolic, that is the minimum number you hear the last beat at. So the average blood pressure is going to be 120/80. Now you're going to want to tighten this all the way. If you don't, you're just going to be pumping air that's going to be going out of the cuff. So you're just going to want to play with it until you feel it go tighter. And once you feel it tight, you're going to want to pump it to an average of 160. Anything more than that, it's uncomfortable for the patient. And you're not going to want to stay at 160 for a long time, because this is going to be tight and it's going to be irritant for the patient's skin. So you're going to be wanting to look for the systolic number while slowly releasing the air. So while I'm slowly releasing the air, I'm listening for that first beat, in which I find it at 120. And you're going to constantly want to go at that pace until you find the minimum number in which you find the beat, which I find 180. And once you're sure you find that last beat for the first step, you're going to want to take everything off and do it again. So my first reading was a 120/80, which is an average blood pressure number. To get a more accurate result with the second one, you're going to want to restart every process. So you want your patient to get up, stretch around a little bit. So once your patient has had a comfortable time stretching out, you want her or him to sit down again. And you're going to want to repeat this process for a second time. And once you get that reading, you're going to average those 2 together to get the most accurate results as you can. Thank you for watching.